All right, in this next video, we are going to talk about something called a renal oncocytoma. So renal oncocytoma is another type of tumor, but I really want to highlight here, this is a benign pathology. This is something that has a really good prognosis overall. Now, an oncocytoma is formed from oncocytes, which are types of epithelial cells that have an excessive amount of mitochondria. So if we draw our attention to the pathophysiology here, we hit on some of the main points. We said this is benign. It's an epithelial tumor originating from the intercalated cells in the collecting duct most commonly. And recall, our collecting duct is the last portion of the nephron, right? It goes through the proximal convoluted tubule, goes through the loop of Henle, the distal convoluted tubule, and down through the collecting duct. So I'm highlighting that here in purple. And in that collecting duct, we have a variety of different types of cells. We have alpha intercalated cells, beta intercalated cells, and those are specific type of cells that we typically see this tumor develop in. That is a very nitty-gritty question. I really don't expect them to ask you that, but potentially they could. So knowing it's the intercalated cells in the collecting duct is a fact to have in the back of your head. Now, if we look at the etiology here, you can see that it's typically unclear. We don't really know why people get this. It's potentially genetic, but there's really not a classic presentation for it. There's not really a classic gene that we know of. There's not really classic sporadic mutations that we're aware of at this time. And because of that, there's not really a classic presentation for it. However, when it does present, it's going to often be asymptomatic, again, complicating diagnosing this condition, or will present with some of our classic kidney findings that we expect with renal pathologies. These include things like painless hematuria. This is really important to keep in mind that this is painless, right? We'll talk about in the next video a couple different types of bladder cancers that present with painless hematuria. This is in contrast to painful hematuria, which we would not see here. This is more likely to be seen in things like nephrolithiasis, right? This is a very painful thing to pass stones through the urinary system. But in this type of benign tumor, it's the painless hematuria that's most likely for these patients. Now, you can also see some other findings, including flank pain or an abdominal mass if the tumor gets large enough. When we consider our diagnostics here, we want to focus on the imaging studies, which can include an abdominal CT or an ultrasound. Similar to what we talked about in the last video, you can get an ultrasound to probably see this tumor if it's large enough. However, a CT is going to be a more detailed picture. And so if a patient is able to get that, that will be the preferred testing option to really see how big is this tumor and what is the actual architecture of it in the body. Now, we also want to consider our pathology, and we have our macroscopic pathology and our microscopic pathology. So in short, that means macroscopic we can see with our eyes. Microscopic, we actually need to see under a microscope. So if you draw your attention to the image down here, I am circling a renal oncocytoma. This is described as being well circumscribed, so it has clear defined borders as a brown tumor with central scarring. So you can see by looking at the color of this, right, you would appreciate this is a brownish, goldish tumor, right? And there is this area of central scarring right in the middle that we expect to see with these tumors as well. So these findings in combination with one another, well circumscribed brown tumor with central scarring, well, this is a classic macroscopic presentation that they could give you on a question stem and expect you to realize that, oh, that's the benign oncocytoma. Now, when we look at microscopic views, we're going to draw our attention over here. And I think if you look at this closely, you can probably delineate a very stark contrast from where I'm drawing the purple line between what's going on over here and what's going on over here. We're saying the microscopic pathology has eosinophilic cells without perinuclear clearing and abundant mitochondria. So based on that, which side do you think is actually the renal oncocytoma from this pathology? Well, it's going to be this side that's really dense with a lot of pink eosinophilic cells. This is the side of the oncocytoma. And we know this because there's no perinuclear clearing in addition to abundance of mitochondria. Versus this side, this is more of our classic tubules that we would expect to see in the kidney itself. Now, when we talk about management here, it's important to keep in mind that we said this is a benign tumor. This is not an invasive tumor. Look at how well circumscribed this is, right? This is not something we would expect to grow out into the renal vascular system and thus metastasize to other places of the body. And because of this, you don't always have to do something. However, if you were to do something, if a surgical indication was made, you can resect the tumor in order to exclude renal cell carcinoma. So if you're not sure that it might be malignant, it might be an oncocytoma, or it might be renal cell, we'll just take it out and then you can do pathology and figure it out for sure. Additionally, if the tumor is significantly enlarged, so that's compressing on other structures or it's affecting the patient's quality of life, it can be removed as well. But if it's a small tumor, it's not bugging anything, and you've done the workup to determine that this is a benign oncocytoma, you can actually just use surveillance and watch these patients over time to see if there's any changes. So it doesn't always require an intervention, but if you were to do a surgical intervention, there are options to do so. So a classic vignette might be something along the lines of a 40-year-old patient presents with hematuria in their urine. You ask about their symptoms. They say it's not very painful. It's just new for them. It's been going on for 3 or 4 weeks, but they have no other symptoms, right? This can be a fairly asymptomatic presentation. You do a physical exam and notice that there's a palpable mass in the patient's flank. You decide to get a CT to further work up this patient, where you notice that there is an enlarged mass on the kidney. Now, to determine if it's benign or if it's malignant, you end up getting a biopsy, which shows you something along the lines of this over here, ultimately indicating this is likely an oncocytoma for the patient, of which this can be treated with surveillance or surgical intervention, depending on the various indications. Overall, a fairly low yield pathology, but that's how it would classically present in a patient if you were to get a question on it. So just a quick summary of this video. A renal oncocytoma, it's a type of renal cancer. We talked about renal cell carcinoma before, which is malignant. This is a benign epithelial tumor. It's unclear etiology. We don't really have a classic patient presentation for this, but the presentation can include our pretty classic renal pathology symptoms, such as painless hematuria, flank pain, or abdominal mass. Just as a general rule, painless hematuria, often the level of step 1 suggests a malignancy, versus painful hematuria is more likely to be indicative of kidney stones or nephrolithiasis. Now, it's important to note that these patients can also classically be asymptomatic. They might not know this is going on until symptoms develop. Fortunately, it's a benign tumor that doesn't invade the vascular system, so this isn't as big of a deal as it might be for the RCC, which we said is also sometimes known as a silent tumor because it doesn't show symptoms until it's later on in this progression. Now, when we consider our diagnostics, we're looking at our classic imaging, a CT. Our pathology can be looked at in a microscopic view, where we would see a variety of eosinophilic cells and dense mitochondria. Remember, that's what oncocytomas are. They're epithelial cells with excessive mitochondria. And our macroscopic view is going to show this classic brown tumor with this area of central scarring in the middle.